In this video, we will discuss clinical decision support systems, known as CDS or CDSS. CDSS generate clinical alerts and warnings for clinicians at the point of care. It is important to note that clinical decision support is different than the traditional concept of decision support, which is the creation of reports and analytics to aid in business decisions. CDS alerts can be drug-to-drug interactions, drug and allergy interactions, anomalies in lab results, preventative care suggestions based on a patient's demographic and diagnosis information, and numerous other alerts that are able to be generated programmatically based on inputs and metrics that are gathered about a given patient. Meaningful use requires the use of CDS in the provision of care. CDSS are typically found within the EHR system itself because the EHR is the central point of data collection and storage. The CDSS then analyzes this data. Prior to EHR, allergy and interaction checking was a more manual process and relied on the physician or pharmacist to manually check for allergies and interactions. With CDS residing in the EHR, the provider is notified immediately at the point of order entry if there is a potential concern with the order he or she is writing. This is just one example of how CDS creates efficiency and improves safety and quality. While CDS has many benefits with regards to reducing errors and enabling clinicians to intervene when an alert is triggered, it is not without unintended consequences. Alert fatigue by far is one of the biggest concerns with CDS. Alert fatigue occurs when a clinician regularly sees numerous alerts and becomes accustomed to overriding or acknowledging those alerts without much consideration. They may do this when the system generates alerts too frequently, and the alerts are either erroneous or are supplemental information as opposed to emergent alerts. When a provider sees too many alerts that are mild, benign, or flat out wrong in their expert opinion, and they become accustomed to clicking past the alert, they are much more likely to click through any alert the system generates without stopping to analyze the alert. Essentially, a really critical alert can be overlooked due to a provider seeing too many of the less important alerts. This is why the tuning and setup of the CDSS is extremely important to its success. Changes in power structure is another unintended consequence. That is to say that historically the doctor's order was the doctor's order, and very few questioned it. With the advent of CDSS, some providers may feel as though their professional opinion and orders are being questioned, and being questioned by a computer for that matter. Differential diagnosis CDS systems offer potential diagnoses based on numerous clinical metrics for a patient that would be extremely time-consuming and difficult for a medical provider to evaluate for extremely complex clinical cases. Again, some providers may be resistant to differential diagnoses offered by a computer system. In reality, doctors should view CDSS as a tool to help them provide the highest quality of care and not a system that threatens their expert opinion. On the other hand, overdependence on technology can also be an unintended consequence of CDS. The CDSS is not a replacement for the clinician who sees and treats the patient. CDS is not meant to replace the expert opinion of the physician, but to aid them in their decision on diagnosing and treating a patient. There are numerous other unintended consequences, but the ones previously noted here are the most common. In summary, CDS has enormous potential to aid providers in the treatment of patients, but the systems must be configured properly and continually monitored, tuned, and updated. They have the potential to reduce medical errors as well as improve quality and reduce costs.